We get like a sign, so like a
Oh,
quick
okay.
slide this.
This is so close up.
I'm recording already. So start. Yeah, totally. I mean, okay. Her things in here, right?
Mm-hmm. Okay.
Which one is it?
Okay. Good afternoon, everyone, and thank you for your patience. We are ready to begin our current webinar that's part of the Jonas 2020 Jonas Nursing and Veterans Healthcare webinar series. Thank you to all of you who have joined us this afternoon, and please note that this webinar will be recorded. Remember that Jonas Nursing and Veterans Healthcare is the signature program of Jonas Philanthropies, founded by Donald and Barbara Jonas. And our program works in partnership with schools of nursing around the country to identify and invest in high potential doctoral nursing scholars. We are the first and only privately funded program in the nation with a presence in all 50 states, and we're focused on the commitment to the nursing profession and veterans healthcare with over 1,200 scholars funded to date. Please be sure to follow us on social media at Jonas Philanthropies on Facebook and LinkedIn, and at Jonas Impact on Twitter. You can also visit our website to see our list of upcoming events at www.jonasphilanthropies.org. That's in our media library as well as our listing of upcoming events. Today's webinar is entitled How Nurses Are Using the Human-Centered Approach of Design Thinking to Solve Health and Healthcare Problems. We thank Ms. Mariam Leary from the University of Pennsylvania School of Nursing. She's there as the Director of Innovation, and we appreciate her taking the time to share this information with us today. We will be offering continuing nursing education credits. So as a reminder, please use your chat function to submit your questions, and the Jonas Nursing and Veterans Healthcare staff will monitor them to help moderate your questions throughout the session. For those of you who would like to obtain continuing nursing education credits, you will have more information available here at this link. We'd like to thank our partners with Columbia University School of Nursing and their continuing nursing education program for providing this service to us. And now we'll turn it over to Mariam Leary. Thank you so much. And we're going to pull up your slides for you.
Great. Well, thank you for having me. I really appreciate you letting me talk today about using human-centered design to solve problems in health and healthcare. Next slide, please. So as was mentioned, I am the Director of Innovation at the University of Pennsylvania School of Nursing, and I've been lucky enough to be in this role for the past year. I'm also a member of the Innovation Advisory Committee for the American Nurses Association, and on a number of other innovation committees for the American Heart Association, and a founding member and on the board of directors of the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders, and look forward to talking with you all today about some of the upcoming events that are going on around nursing and innovation, as well as how you can use design thinking in your practice. Next slide, please. Just one disclosure, I am a co-I on a grant funded through the Rita and Alex Hinman Foundation, which I'll be talking about our project Design Thinking for Health. Next slide. So what is innovation? So innovation means a lot of things to a lot of people. And for us to really be able to integrate innovation into the work we're doing as nurses, we really need to define what we're talking about. Next slide. So at Penn Nursing, we define innovation as the application of something new or different that delivers value. It is a methodological approach that is infused with creativity and risk-taking. So innovation is not just technology or widgets. It really is the methodologies that we're using to create solutions to problems. It's the processes and the systems that we create, and it's also the way that we communicate with each other, our colleagues, our patients, their families, and really the general public at large. Next slide. So innovation sits at the intersection of viability, feasibility, and desirability. Is what you're creating able to be scaled up? Does it work the way that you are intending it to work? And do people want to use it? Those three things are really what makes innovation so special. You need all those three things to be able to really move your idea forward in any discipline, but especially in health and healthcare. Next slide. So why health and healthcare innovation? Well, we know that it can take anywhere from 10 to 17 years to get something from bench to bedside, out to the people who need it most in the hospitals and the health systems out in the community. But using design thinking and innovation methodology, you can really start to rapidly prototype and test solutions to ideas in weeks to months instead of years. And the methodology of design thinking and human-centered design really puts the focus back on the stakeholders for whom you're designing for. And so allowing us to really understand the problem from the point of view of the people who are experiencing it. In addition, it really allows us to work with an interdisciplinary team of providers. So not just other healthcare providers as nurses, physicians, respiratory therapists, et cetera, but to really go outside of healthcare and work with designers and engineers and business folks and everybody who brings a diverse set of knowledge, skills, and backgrounds to the problems that we're trying to solve in healthcare, including the patients. Next slide, please. So why nursing innovation? So nurses, as we know, are at the bedside, but we are in so many other places, which really gives us the breadth and depth to bring a different point of view to the problems that we're trying to solve in these spaces. So yes, we're at the bedside, but we're also in the boardroom, we're in research labs, we're in the military, we're in Congress, we're in the community, we're in all these places and so many more, which really puts us as the keystone in solving the problems that we're seeing in our practice every day. Next slide. So there are nearly 19 million nurses worldwide, which means every product and process that touches a patient goes through a nurse, which is one of the other reasons why nurses are such incredible innovators. We see the problems and come up with solutions on a daily basis. Next slide. Which gives a lot of areas for growth and opportunity. So one of the biggest problems right now is that innovation is not a core component of the nursing curriculum. And that's one of the things we're trying to change here at Penn Nursing. And one of the things I'll be talking with you about is our Innovation in Health course, which is a Foundations of Design Thinking class, so that we can help to train the next generation of nurses as leaders in this area. One of the reasons we want to do that is because clinicians at the bedside are already solving problems, but these solutions are generally one-offs where they're solving these problems during their shift on their floor and then moving on, and those solutions are being lost. The same problem is being repeated. It could be repeated in the room next door, on the floor, or in different parts of the hospitals and beyond. And so we want to take all of these amazing ideas that nurses create every day, solutions to the problems that they're seeing, and help scale them up. We also want nurses to see themselves as innovators. Like I mentioned, nurses are consummate innovators. We're coming up with solutions to problems on a daily basis. We just don't use that language and see ourselves in that way. And we really are trying to now create a culture of innovation in the profession and educate nurses as leaders in this area. Next slide. So this past year, we released a report, Penn Nursing and BDO, which is a consulting company, released a report called Unleashing Nurse-Led Innovation. Next slide. And for this report, we surveyed both clinical leaders and business leaders and asked them what the 5 nursing areas with the most opportunities to transform care by 2025 would be. And both clinical leaders and business leaders ranked innovation at the top of their list on where they really would see the most opportunity for innovation in healthcare. Next slide. You can keep going. We also asked them what the top 4 most valuable skills for nurse innovators would be by 2025, and both groups said design thinking for process change. And next slide, please. So what is design thinking? Well, design thinking is a 5-step process of empathy, define, ideate, prototype, and test. It's a human-centered approach to innovation that draws from the designer's toolkit to integrate the needs of the people. So design thinking came out of the field of design and has been slowly infusing itself into health and healthcare over the last 5 to 10 years. It's a framework that really allows you to generate innovative solutions through a creative problem-solving framework. And so, as you can see from this diagram, it is not an iterative process, but it is, it is not a linear process, it is an iterative process. Though the foundation is empathy, you then move into define, ideate, prototype, and test, but you're always going back and refining and thinking about ways to improve in each of those areas. And I'm going to walk you through each of those phases of the design thinking process using an example from one of our student groups throughout our previous semester. Next slide, please. We're going to skip this slide. All right, so at Penn Nursing, we teach a course called Innovation in Health, Foundations of Design Thinking, and it's open to all students across Penn's campus. Though it's housed out of Penn Nursing, we have students from all the other schools who can take this class. So we've had students from Penn Medicine, Penn Vet, Engineering, Architecture, Wharton Business, and of course, Nursing. It's an undergrad and graduate level course, and it is an active learning flipped classroom approach. So the students do all of the reading and lecturing prior to class, and then when they come into the class, it's all active learning where they're working through activities on a real health and healthcare problem. And so they're in interdisciplinary teams of nurses and engineers and designers, et cetera, who pick a topic that they want to work on throughout the semester, and then work through the design thinking phases throughout the semester to come up with a low fidelity prototype, a pitch and pitch deck, and then they test out their solution by the end of the semester. Next slide. This is just an example. We have a nice mix of interdisciplinary students in the class. Over the 4 semesters we've run the course. Ranges anywhere from like 75% to 60% nursing, and then 25 to 40% all of our other interdisciplinary colleagues. Next slide. So the way the course is set up, we spend 2 weeks on each phase of the design thinking methodology so that students can really get a good understanding of what that phase entails and the different activities that help them to work through those phases. The nice part about design thinking is it really is structured, and there are a number of resources, established resources, that you can use to help move your idea from the early phases of empathy all the way through to the testing phase. And so we spend 2 weeks on empathy, 2 weeks on define, and so forth throughout the semester. Next slide. And this is really what our classrooms look like. The students are out of their seats, they're active, they're drawing, they're using a lot of Post-it notes, a lot of supplies that you would see in a kindergarten classroom, markers and Play-Doh and pipe cleaners, all to help them think creatively and think differently about the problem that their group has been tasked to try and solve. But they don't do it alone, and the foundation really is on empathy. You can go to the next slide. So what I'm going to do is I'm going to walk you through each of the design thinking phases based on this project that one of our student groups worked on last semester. Their problem was looking at irritable bowel syndrome in active millennials, and they called their team or their solution Flex C. Next slide. So the first stage of design thinking, like I mentioned, is empathy. So empathy really allows you to gain a deeper understanding of the people and population that you're creating a solution for. So as designers, as researchers, as clinicians, we're not going out into the community and telling people what we think they need. We're allowing them to show us and tell us what it is that they think they need. So the empathy phase really is all about going out to wherever the problem is occurring and interviewing stakeholders, talking to the stakeholders, observing what's really going on around whatever the problem is that you're trying to solve, and letting them show you and tell you what that is so that you can then bring all of those data back to the group and begin to think about how to solve the problem. But making sure that knowing that you can't solve the problem unless you really understand in a deep way what the problem is. Next slide. So there are a number of ways to do that, and what I'm going to do throughout this portion of the talk is really share with you some of the activities that are available to work through each of these phases, but also highlighting it in the process of the group that worked on this FlexC project. So we first had them define their audience. So again, to really understand the problem, they had to go out and observe and talk to the people who it affected. So, and then come back and really define who that audience was. And so they went out to irritable bowel syndrome support groups, and they listened to what the folks in the support group were saying. They talked to individuals. They tried to understand what the daily life was like for somebody who was a young adult living with IBD. Next slide. And so there are a number of different activities that help you to really understand how to interview and observe in a very thoughtful way to help get the data that you need to then come back and solve the problem. And so as you can see here, there are two techniques that they used while they went out and interviewed and observed. And then the picture here is when they came back and they were starting to put together all of those qualitative data that they got from those interviews and observations. And again, design thinking is really a creative problem-solving approach. And so I highly encourage my students to draw things out, to write things out in other creative ways so they can visualize what was going on. Next slide. And then we have them do something called an empathy map. So from all the data that they brought back, thinking about what the stakeholders said, what they thought, what they were doing, and what they felt, so they could start to really put into clusters what each of the themes might be in those areas. And this really helps you to get a good understanding of who your user is, because there could be multiple users for one problem, but you have to really know who that one user is that you're designing for so that you can get the right solution for that right person. Next slide. And then we also talk about, you have your typical users, but you also have your extreme users, and you want to be able to understand the problem from the point of view of all the people who are experiencing it, not just the general average user. And so we have our students also keep in mind that when they're going out and interviewing, observing, they really want to get that wide range of user perspective so that they can create a comprehensive solution that fits the needs of all the people in that population who are experiencing the problem. Next slide. So from the empathy phase, you really get a good understanding of the problem, again, from the point of view of the people who are experiencing it. Now you're taking all those data and you're really trying to define the problem from the point of view of the user. So this is where you put all of your insights together from the empathy phase to try and come up with a problem statement that addresses the problem from the voice of the stakeholder who is experiencing it. Next slide. And one of the ways that they do that is through this activity called a journey map. So they start to think about what the problem is and a typical day or a typical scenario where the problem is occurring. And they write out the journey of that person and what the pain points are. So for the group who is looking at irritable bowel syndrome for young millennials with IBD, they started to think about what the problem was based on the information that they heard. And so they mapped it out. So young millennials are worried about going out, being active. So for example, going out for a morning run with their dog. Well, if they have a bowel accident or bowel urgency, there's no restrooms on their route, or there's restrooms, but they can't bring their dog in. And so thinking about the problem that they want to have an active life, but bowel urgency is making it difficult. So, you know, they go out for a run, they have an urgency, there's no bathroom that allows dogs. Now they decide they shouldn't go out for a run. Like, this is the thought process that they have to map out, where the issues are and how they could potentially solve problems in these different areas. Next slide. And then they start to think about what the problem actually is based on all of those data and based on that journey map. So if you can see this template here, it really lays out what you're trying to accomplish with the problem statement. So I am, and if you can see the bottom, it says user description. I am trying to, goal or outcome, but problem or barrier, because, root cause, which makes me feel, emotion. So if you click again, please. So the problem statement that this team came up with, based on all the empathy phase activities that they worked on, and then based on these definition activities, was this one. I'm an individual battling the challenges of inflammatory bowel disease. I'm trying to maintain an active and social lifestyle, but bowel accidents sometimes follow me outside of the home because public spaces are not designed to meet my needs, clean, accessible, single use, etc., which makes me feel embarrassed, isolated, and vulnerable. So this problem statement really gets at what the issue is for that population of young millennials who are experiencing IBD. And with this problem statement, now they can really focus on a solution that addresses that specific problem. So this whole design thinking methodology is a process, and these activities throughout the class that I have the students do really help them to walk through these activities in a systematic and rigorous way. Next slide. So after the define phase, there's the ideation phase. And this is really one of the fun phases where they get to start to brainstorm and think about solutions to the problem that they have identified. Now, like I mentioned before, this isn't a linear process, it's an iterative process. So at each phase, my students have to go back to the key stakeholders that they were interviewing and observing, and keep engaging the stakeholders to make sure that the problem statement that they identified is really a problem statement that resonates with the key stakeholders. So again, we're not telling them what we now think the problem is, but we're allowing them to tell us if what we came up with as the problem statement really does address the need that they have identified. So then we really start to brainstorm. And again, there are lots of activities in the design thinking resources that lend you to good brainstorming sessions. And what I tell my students to do is, in this period, there are no constraints. Like, don't worry about finances, don't worry about science and physics, don't worry about any of that. Really start to come up with some of the most creative ideas that you can, and then we'll start paring those down. But this is really a time to just spitball and think about any and all solutions that could work to answer the problem that they've addressed. And then they start to put all those ideas together. Next slide. And then once all the ideas are out there, they start to bundle them together. And the teams do this both individually at first, and then they come together as a group and do brainstorming as a group, and then they bundle all their ideas together to see if any themes start to emerge that would best answer the problem that they've identified. Next slide. One of the ways that I help them think outside the box is through activities like this one. It's like, it's not like. So thinking about if you're, say, trying to solve a problem of food service in a hospital, what is it like, what is it not like? Well, it's similar to when you're at home and you want delivery service. So for example, if you're in the hospital and you're hungry and you've missed meal service, you want something different than what the hospital meal service is serving, could you then say, I want something that's like Uber Eats or DoorDash, but for the inpatient population? So what's it like, what's it not like? And so you can start to think about what is happening in other industries that could potentially also answer the question and solve the problem of what you're doing in the in-hospital setting or in the community setting. Next slide. I also, in this phase, when they're starting to brainstorm and come up with ideas, have them get visual. I am a big proponent of not just using text, but also drawing and being visual. And so this team started to draw out some ideas that they were thinking of for a solution to the IBD urgency issue. And so as you can see here, they started drawing out certain types of undergarments. So the Get Visual activity really allows you to be a little more creative than just writing things on Post-it notes. We have students who have used modeling clay to create, asthma inhalers and using pipe cleaners and things of that nature, just to start really thinking more visually about what solutions could be used to solve their problems. Next slide. So we have the students go through the first couple of phases of the design thinking process, and then mid-semester we have them do a storyboard to really reassess where they're at in this process, and to be able to put that all together in a way that tells a story so that in the next phase, prototyping, they really understand who the person is that they're solving the problem for and what is the solution that they're going to be using. And so this team did a really nice job of drawing out, a young millennial out on a run with her dog, has a sense of urgency because of irritable bowel syndrome, but can't go into any of the places where there's a bathroom. She has an accident. It makes her feel embarrassed. She's late for work. Her friend wants her to go out, but she doesn't want to go out because she's feeling socially isolated now. And so the solution that they come up with is a new type of undergarment that is water resistant, odor resistant, stain resistant, and makes the young millennial feel more confident about going out. And so this mid-semester storyboard is really starting to frame how they see the solution to their problem. Next slide. And then they get to start to build it. So they draw it down on paper on the mid-semester storyboard. They really start to visualize it and understand what it is that they want to do. Now they get to build it. And so this is the fun part. The prototyping phase, you get to create a low fidelity working prototype that they can then test with their key stakeholders and other students in the class. And when I say low fidelity prototype, it really is could be anything from something made out of construction paper and Play-Doh and cardboard and pipe cleaners to, depending on what the solution is, application on a computer or a fake front-end website. The whole purpose of a prototype is so that you can show your stakeholders what it is you're thinking the solution will be, and they can interact with it in a way that can show you what works and what doesn't work. Next slide. So this phase is called rapid prototyping. And as you can see here on the right-hand side, these are the rapid prototypes that our students created for their Flexi solution. So we have a materials library here at Penn Nursing, or here at Penn, that has a number of different materials that students, designers, faculty can come and check out and see what would work and what wouldn't work in a prototype. And so they went over to the materials library and they started to research some of the materials that could be used in this type of garment if they were to create it for real. And so they were able to find out that there actually are odor-resistant materials, there are water and stain-resistant materials. And so for the low-fidelity prototype, they designed both an inner shell of an undergarment that could be disposable and an outer shell that was water and odor-resistant that they could create with a designer that would be visually appealing to young millennials, but not bulky not bulky that it would resemble a diaper. Next slide. So after the prototyping phase, then they started to test, and that's where you really get feedback from the key stakeholders to make sure that your solution is actually doing what you intended it to do. This is that feasibility part we talked about when we were talking about innovation in that sweet spot of feasibility, desirability, and viability. Next slide. So live prototyping or testing is just working through if it would do what it says it would do. So the students here created their undergarment that they then tested. So they were creative in that they used chocolate pudding to represent stool, and they were able to test to see if the materials would be water absorbent and liquid resistant, and if they could get the garments on and off, and the disposable part, if it actually was easy to take off and throw out and replace and still use that outer shell as well. They made a really incredible video showing that they were able to use this low fidelity prototype in that way. So it was a very successful prototype. Next slide, where they got a lot of feedback from their student colleagues about what their likes were, what their dislikes were, other ideas and questions, and they were able to capture all that in a very concise way using this feedback capture grid. And the whole process of design thinking is that, again, you are iterating. So this low fidelity prototype, you do these low fidelity prototypes because you can create them quickly and they're low cost, and so you can change what you need to in a very quick and cheap way so that you can then go back, iterate, and then test again. But for this class, they were able to show that they could, the solution would work for their needs. Next slide. And part of the capturing of feedback, you also allow those who are testing it to tell you what they liked, what they wished it would do, and to give you other ideas about, well, what if it could do X, Y, or Z? Again, making this a very collaborative process, you always would go back to the key stakeholders and then try and incorporate as much of their feedback into the product as you could. Next slide. And then, so once the students have created their entire solution, they do a final pitch and pitch deck in the class where they talk about what the problem was, what the solution was that they created, and if there are other comparable products on the market. The whole purpose of this is really just to expose them to what it's like to be able to pitch a problem and solution, which is very different than a research presentation. Next slide. Part of the class, if they're graduate level students, is that they have to do a case study that really summarizes what their process was from the beginning of class through the end of the semester and what the process of working through the design thinking phases were. I show this to just show that we have a lot of really talented creative students, and one of our students in this Flex C class wrote a poem about irritable bowel syndrome and the process that they went through during this class. I know it's really small and hard to see, but if you have time at a later date, it is really well done. And like I said, our students are super creative. Next slide. And this is the group. Now, we always try and have an interdisciplinary group of students. This semester, we had 4 nursing students who were in this group, which I think is even more impressive. They did not have a designer, they did not have an engineer, but they were able to come up with this incredible undergarment solution to that problem. And again, really well done. And I just like to give my acknowledgments to that group for the amazing work they did throughout the semester. Next slide. So that's the design thinking process that we teach in the Innovation in Health course. And we get a lot of really good comments and feedback. One of the ones I like the best is that it's the most fun they've had in a class since kindergarten. It's both a really great comment and a really sad comment. I would like more fun throughout all the nursing education that we're doing. You shouldn't have to wait till upper level undergrad or graduate school to have fun since kindergarten. But that's why active classrooms are really important. That's why the design thinking methodology, I think, works really nicely in health and healthcare and in nursing specifically. Next slide, please. All right, so I want to talk with you all now about the Design Thinking for Health platform. So we were fortunate enough here at Penn Nursing to get a grant through the Reed and Alex Hillman Foundation to create this online open access platform called Design Thinking for Health, where any nurse can go to learn about design thinking and to use the methodology that I just talked about to take an idea from conception all the way through to implementation. The website is listed there. And so, oh, it's all right, go ahead.
I can't see it. I don't know what it is.
So the Design Thinking for Health curriculum is, like I said, free, online, open access for anyone to use. It includes 4 documentary videos that highlight nurse innovators from around the country, including 6 original lecture videos from nursing and design experts from organizations like CVS Health and Microsoft, and then also 7 podcast interviews as well. And then the course is set up similar to the class that I just talked about, where you're able to walk through each phase of the design thinking process, and it's very structured so that you know what you're going to be reading, watching, listening, and then doing. Next slide. So like I mentioned, we laid it out very easy and clear so that you know what you're going to be doing. For example, if you're going to watch the video portion in a certain section, we've laid out how many minutes each of these are so that it's asynchronous learning. You can go back and forth to it as time allows, and you can walk through each phase of the design thinking process in that way to learn each of the skills in those areas. Next slide. And this is what the website looks like. Each of the videos, readings, podcasts, etc. are listed. And then all the activities that we have listed are existing design thinking resources. We were not recreating that wheel, but pulling from the expertise of the design field that's already out there. So Collection Action Toolkit, the Stanford D-School, Field Guide for Human-Centered Design, all those established design thinking organizations already have these free resources that you can use to walk through the process, similar to what I showed that we use in our classroom setting. Next slide, please. And I just wanted to show you, these are the wonderful nursing, innovation, and design thinking experts who gave their time to this platform. So we have our 4 case study videos that highlight nurse innovators from around the country, our podcast interviewees, and then lecture videos from established design and nursing innovation experts. So we really want this course to be used by all nurses, both in the, at the bedside and in academia and wherever you practice. And so, like I mentioned, the course is free for anyone to use. So we really envision people who are working at the bedside could do this course as individuals. Health systems could take components of this course and integrate it into existing workshops. Universities can take this whole entire platform and create new courses for their students based solely on this platform. It is there for everyone to use so that nurses can really start to learn the methodologies needed to, again, take their ideas from conception all the way through to implementation in a very structured and rigorous way. And the platform, next slide. And the platform is really used also to build a community of nursing innovation leaders. And so you can sign up and we send monthly updates of new information that we come across that we're listening to or reading around design thinking and nursing innovation. So if you want to learn more about this platform, please go to designthinkingforhealth.org and you can sign up, and you can also just start doing the course for free, looking at all of the videos and materials that are there to really get a better understanding of why nursing innovation is so important and how design thinking helps to move that forward. Next slide. So I want to just also mention a few things. So we at Penn Nursing had just launched our first Innovation Accelerator program. And this lecture is really about how nurses are using design thinking in their practice and in health and healthcare. And so we just launched this Innovation Accelerator where we had faculty and students who have an idea to a health or healthcare problem who are going to go through a 10-month accelerator program where they get funding, they get education, and they get mentorship. Next slide. And so we had a pitch event where we had our dean open the event and talk about nurses as innovators. You can just cycle through. There's like probably 5 slides with pictures that I just wanted to show. Anthony and Pam, our first 2 finalists, went through our Design Thinking for Health class. And so they were able to use the skills and knowledge that they learned in that class to then pitch their solutions to ideas at this Innovation Accelerator program. You can keep going. And then we had Dr. Bonnie Clipper, who was at the ANA as their Vice President of Innovation, was one of our guest speakers, talking about why innovation in nursing is so important. You can keep going. And then, you know, we had our finalists who pitched, everybody won, and now they're all going through our 10-month Nursing Innovation Accelerator program. Again, using Anthony and Pam, using the skills that they learned around innovation and design thinking to really help launch them into this program. Next slide. And these are just fun visual sketches that were done at the Innovation Accelerator program talking about, so Anthony pitched a, what he called Nona, which was a personalized program where he wants to go into hospitals to make the rooms more homey for long-term care patients. Dr. Casione is pitching smart socks for heart failure, and our other team is pitching just-in-time palliative care. And so we had a visual sketch artist who did these little images from the Innovation Accelerator while they were pitching those solutions. Next slide. Another example of where design thinking is starting to show up. So SUNCIAL, which is the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders, had a nurse hackathon in November that was sponsored by Johnson & Johnson. 200 nurses came and participated in that nurse hackathon. I was fortunate enough to do a talk on design thinking, and then throughout the weekend, a variety of the teams used the design thinking methodology during the process of creating a solution to an idea. For those who aren't aware, a hackathon takes place over a weekend. You pitch an idea on Friday night, and then you work on the idea throughout that Saturday and Sunday. And so we were able to help the teams work through that process using design thinking methodology. And 2 of the teams who won had students, we was just a coincidence, had students on it who had also taken the design thinking class at Penn Nursing. So a lot of good information and good skills and knowledge comes from learning the design thinking process. And for those who are interested, SunScale is doing another Nurse Hackathon September 11th to the 13th. If you have any interest in innovation and you're a nurse, this is a really great event and one you could definitely consider checking out. Next slide. So as we're wrapping up, I know we're coming to time soon. I just want to mention a couple other things for those who are really interested in learning more about nursing innovation, design thinking. We do Twitter chats quarterly at Penn Nursing under the hashtag Penn Nursing Innovation. We just had one this past week on hackathons. We've done them on the topics of innovation, design thinking, creativity, and storytelling. And we get experts from around the country to discuss those topics over 1 hour on Twitter. We also are really interested in storytelling. Storytelling is a big part of design thinking and a big part of innovation. And we just recently had our second annual Story Slam event where we had 10 nurses from Penn Medicine and Penn Nursing tell their real life story around a theme of courage. And they performed it as a storytelling event at a local storytelling venue here in Philadelphia. Next slide. And finally, I just want to mention we recently launched our Amplify Nursing podcast, which features nurses who are paving the way in science, innovation, and policy. This podcast is an interview-style podcast. These are our first 4 episodes that you can get on iTunes, Google Play, or wherever you listen to podcasts. And you could check out these interviews with some leading nurse innovators, entrepreneurs, policymakers, etc. We are not the only ones doing podcasts, so I just wanted to give a shout out to a number of other folks who have nursing innovation and design thinking podcasts. If you're interested in this topic, you're on this webinar, you probably are. I highly recommend checking out the CU Now podcast from Johnson & Johnson and ANA, the Handoff podcast from Trusted Health, and then At the Core of Care from the Pennsylvania Action Coalition, as well as the Design Thinking 101 podcast. All of them have great information and really good engaging episodes. And there are a number of other podcasts. I actually am just starting to put together a list of nursing-focused podcasts. If anybody's interested, I'm happy to share that. And with that, I will answer questions. Thank you.
Thank you so much, Marion. This was really good and very informative. We do have a few questions that have come in. One is particularly about the Nurse Hackathon. And
Sure.
Wondering, is that just restricted to nurses or can others from other disciplines attend?
No, and great question. The best part about hackathons is that it brings together an interdisciplinary group of people to work on problems. And so the best hackathons have not only healthcare providers, nurses, physicians, pharmacists, etc., but engineers, designers, key stakeholders, whoever the problem affects and whoever could potentially help to address and solve that problem are invited to attend hackathons. It is an amazing experience if you've never been. It really, the enthusiasm and inspiration that happens over a very intense 2.5-day period is like nothing else you will ever experience. I highly recommend it.
Thank you. And is the event by invitation only, or is there an application? Or is
No, it's open to the public. You just have to sign up and register.
Okay.
So the Johnson & Johnson SunScale one, there's a save the date for September, but registration is not quite open yet.
Okay, that's good to know. And you did share the list of all those different podcasts with us. So thank you so much for that information. We will be making this recording available on our website for everyone who'd like to view it again. It will be available on our website, www.jonasphilanthropies.org. And then one final question was just in thinking about the presentation you gave, where you talked about the classroom setting and how they work together as a group, and then how some of the presenters applied it to maybe their individual work settings or other health collaborations. Do you think there's a preference or one way is better than the other in applying the design thinking theory or idea? So would it work better in a group setting, or would it work better in an individual setting? Do you have any thoughts about that?
No, I mean, I think the best part about design thinking and the innovation methodology is that there is really no rules, right? You can be as creative with it as need be. And so if you're an individual and you want to work through a problem using this methodology, that's great. If you want to use it in a group setting, it's equally as good. It really allows for the flexibility, and there are so many different activities that go along with each of the different phases of design thinking that you really can find ones that fit best for your needs.
Okay, and then some of the participants were asking about the slides. Would you be willing to actually share the slide presentation? Because I think there were some of the details that may not have come across clearly through the actual webinar video.
Sure, happy to have you share them with whomever would like them.
Okay, thank you. So feel free to contact us and we can make those available to you. And so at this point, I know we're wrapping up on time. Again, we really appreciate this information and you taking the time to share with us and participating in our 2020 webinar series. This information was definitely very helpful. I'm sure we'll have many participants now that may reach out to you with more questions or may actually look at the resources that you provided and even enroll in the course that you mentioned available to get more experience with the design thinking. Were there any final thoughts?
I am happy to answer any and all questions. If people have specific questions about how they can use the Design Thinking for Health website, please let me know. You can my contact information is on the slides there, and you can always email me, and I'm happy to set up a time to talk.
Thank you so much. And to all of you who joined us today on the webinar, we really appreciate you taking the time to join us today, and continue to keep an eye out for our upcoming webinars this year and upcoming events. We hope everyone enjoys the rest of their day, and thank you again.
Thank you all. Really appreciate it.
Bye-bye.